Buenos dias, Zamboanga. Welcome sa Kapihan na Zamboanga COVID-19 update kung saan pag-uusapan natin muli ang ating pinakabagong update patungkol sa COVID-19 sa buong rehiyon. We are live via PIA Western Mindanao Facebook page and One TV Philippines and other partner agencies Facebook pages and via cable televisions at e-media and MCTV. Ating kukumustahin pong muli ang ating sitwasyon ng COVID-19 cases at ng ating vaccination program sa buong rehiyon kasama ang Department of Health Region 9. We have Dr. Jimwell Cristobal. Magandang araw, Doc.
Yes, a pleasant morning to you, Ma'am Myra, and to all our viewers. So, proceeding to the situationer for Region 9.
Okay, go ahead, Doc.
Thank you very much, ma'am. As of March 20, we have 153 active cases and 57,300 plus recoveries with 2,477 deaths, bringing us to a total case count of 59,984. The breakdown of these numbers, particularly for Zamboanga City, active cases as of March 20 is at 106 with 27,005 recoveries, 1,098 deaths, and a total number of 28,209. The specimens processed for the day of March 20, or the number of specimens for RT-PCR, total of 129 for this day. And showing us the positivity rating out of that 129, 16.2% were found to be positive for COVID-19. For the bed capacity for our treatment facilities, the total occupation rate, or rather occupancy rate for Region 9 is at 1.07%, which is very low. Zamboanga City has the highest occupancy rate at 6.2%. Looking at the healthcare system's capacity, which is a combination of the isolation beds for COVID-19, COVID ICU beds, and mechanical ventilators used, for the whole of Region 9, we are at 11% ward isolation beds utilized for COVID-19, 32% utilization of ICU beds for COVID-19, and 2% for mechanical ventilators used. If we look at Zamboanga City, now all of the areas are at minimum risk. Zamboanga City is at low risk because if we look at the COVID ICU beds, it's at 68% utilization. So it is indeed increasing. So with that, I end the presentation for our COVID-19 updates. Thank you very much.
Thank you very much, Doc. Nakikita natin that we are really stable na po, no, yung ating mga facilities, and also po yung ating mga cases bumababa na rin talaga for the Region 9. Doc, with that, we would like also to ask po, no, kung kumusta po, how's our vaccination status in Zamboanga Peninsula? Zamboanga City reported that they are already on the 90% po, 90% vaccination rate. Are we near na po ba sa 100% vaccination rate po for the whole region?
We're doing very good in terms of our vaccination for Region 9, the whole of Region 9. Our goal kasi to be able to reach herd immunity is that at least 70% of the total population is vaccinated, with 85% of the A2 or senior citizens. So we still have to vaccinate no less than 869,000 plus individuals in order to get to this target. So, but the vaccination rollout is indeed doing good. But in order to really reach herd immunity, we need to vaccinate this number of people. Yes.
Okay. Thank you very much, Doc. So yun nga yung ating ine-expect, no, nasaan na po. Do we have target date, Doc, or estimated month lang po or quarter that we can achieve po the 100% vaccination rate?
As of present, those in charge of the vaccination rollout are doing their very best, and that's the reason why from time to time we have the Bayanihan Bakunahan, which hopes to increase increase with big numbers the number of vaccination coverages aside from the daily um, targets that we do have. So we don't have a specific date, but everybody's doing their very best.
Okay. Thank you, Doc. Yun nga po, saludo po tayo no sa ating mga nagva-vaccine po, sa ating mga health workers po para po maano pa natin, madagdagan at marami pa po ang ating mabakunahan dito sa Zamboanga Peninsula. Doc, how can you describe naman po the trend of cases here in Zamboanga Peninsula? Can we already achieve po ba the zero case po katulad sa mga ibang cities and provinces natin like Isabela City, zero COVID-19 cases na po sila. So do we have low cases po ba? Because dahil lang ba din po ito dahil konti na lang din yung natetest natin every day?
So yes, in terms of the new cases per day and active cases, we do see a decrease in the numbers. No, take for example for like what we saw earlier today, and so the numbers are indeed low. However, if we look at the bed capacity or the utilization of the ICU beds, especially for like general hospitals, so medyo tumataas ang admissions. So if we look at their numbers there, nasa I think 62 ang admitted for the ICU, rather for the yeah COVID beds. So we still have to keep our guards up, no? Although the reporting of the number of new cases per day is decreasing, but we see a slight increase in the number of admissions. So like what si Ma'am Myra mentioned, is it a question of a decrease in testing capacity? Well, there is no specific uh, memorandum that would really require everyone to reach a certain level, but we are greatly encouraging, no, especially our laboratories, to just continue the testing capacity in order for us to be able to really detect and see the true picture of COVID-19. So I would conclude with just saying that we just still have to really keep our guards up.
Doc, with that po, we hear the new variant, which is the Delta Cron. Can you tell us about this po? Is this dangerous? Mas bahala po ba itong variant na ito?
Yeah, so the Delta Cron was identified through whole genome sequencing, I think late January or February. And at present, mostly the cases are found to be centered at Europe, in the areas of Europe. No? So it's called a recombinant virus or a hybrid virus where which is possible, no, and where two different variants of the virus, in this case, Delta and Omicron, invaded the same cell. And during replication, so they kind of swap genetic parts. And so what they say is that most of the genetic sequence of the Delta Cron appears to be from the Delta variant with the spike protein of Omicron. So it's very early at the moment to really jump to conclusions, but the WHO says that according to their observations, it's quite rare. And since although it's a combination of two different variants, but then it's the same spike protein. So the antibodies from natural immunity or from the vaccination still work. So it's very early, it's quite rare, and we still have to really keep our guards up. Yeah.
Okay. Doc, of course, no, we also started our vaccination for the pediatric sector. Kumusta po? Do we have recommendation for booster vaccines also? One of the questions po ito ng ating mga parents, no? Magkakaroon ba tayo ng booster shots for the children, for the pediatric?
As of present, we don't have any guidelines yet for booster shots for the pediatric population. So our target is for them to first and foremost be fully immunized. Booster shots probably later down the line, because we have to focus our attention and our efforts and the booster shots for the adult population, because although we're doing very good for vaccination, but boostering those fully vaccinated, we're having a bit of a struggle at only 7% coverage. So we have to focus our attention on the adult population first.
Okay. Sige po, perhaps later on we can encourage no kung saan po sila pwedeng bumisita at tumungo po sa ating mga centers for the booster vaccination natin for the adults. Lastly na lamang, Doc, are we, based from the numbers po, are we ready? Is Zamboanga Peninsula ready for face-to-face classes, face-to-face activities, or even limited face-to-face classes po sa ating mga universities and schools?
Thank you. So Zamboanga City, out of the entire of Zamboanga Peninsula, is at alert level 1. So we're the only area that was able to meet the criteria. So one of the things that are allowed for alert level 1 is the allowing of face-to-face classes to be resumed. So the specific guidelines and details of that are provided by the CHED and the DepEd for limited face-to-face classes for children. So the answer there is yes, it's allowed. The guidelines specific are given by the DepEd and the CHED. And so for further information, we can refer to them and our local schools for more information. Yes.
Thank you, Doc. Lastly na lamang, ano po yung ating closing message? Do you have message and also po panawagan and update po from Department of Health?
Yes. So we still would like to remind everybody that despite that we are at alert level 1, let us continue to use face masks, to continue hand sanitizing and hand washing frequently, and practice proper social distancing. And of course, to continue to update ourselves with the right information from the right sources. And of course, to continue our support for the vaccination rollout. Yes, thank you very much, Ma'am Ira.
Okay, once again po, thank you very much, Dr. Jemuel Cristobal of Department of Health 9. And thank you very much din po sa buong team ng Department of Health for giving us this opportunity po para maka-update muli sa ating mga manonood regarding the COVID-19 status and vaccination program natin. Yes po, so maraming salamat po, Doc Jemuel Cristobal. And pinapaalalahanan na po natin ang lahat no to get your booster shots po. Open po tayo dito po sa ating mga ang ating mga vaccination centers. Pwede po nating makita ang mga available sites sa mga Facebook pages po ng ating mga local government units para po makita natin yung mga available sites kung saan tayo pwedeng magpa-booster shots. So maraming salamat po muli sa Department of Health. Bago po tayo magtapos, nais po naming batiin po ang lahat ng Happy Women's Month. Maligayang araw po no para sa lahat po ng ating mga kababaihan. Ngayong buwan po ng Marso ay Women's Month. So we greet everyone po no lahat po ng ating mga kababaihan dito sa Zamboanga Peninsula. Happy Women's Month. So once again, muchísimas gracias po sa lahat ng ating manonood ngayong araw. Maraming salamat sa Department of Health at magkita-kita tayo sa susunod pa pong programa at update natin patungkol sa COVID-19 dito lamang sa Kapihan na Zamboanga. Ito po si Mara Espinosa. Mag-ingat po tayong lahat. Muchísimas gracias.